All right, got a special episode here, bonus episode, if you will. We got training camp well underway now, a week in the books. And of course, with that comes some unfortunate injury news for some players and teams throughout the league. So, no one better to bring on the show here on the Football Lounge than Dr. Jesse Morse of the Fantasy Doctors. Always been bringing good insight into sports medicine and how some of these injuries may be affecting timelines for these players to return. So very happy to have Dr. Jesse Morse here with us today. Dr. Morse, appreciate it. Thank you so much for being on the show.
My pleasure. Thank you for having me.
Before we get into the nitty gritty of these individual players, obviously Joe Burrow, is front and center, and we've got Jalen Ramsey and plenty of others. Give us a little insight into your background, kind of what inspired you to taking your expertise and knowledge from sports medicine to the airwaves and kind of to helping
hmm
others especially in the fantasy football space, but just in football in general, getting a better idea of some of these timelines and what these injuries mean, because a lot of these teams obviously keep things close to the vest. So it's good to get insight from doctors such as yourselves about what realistic outlooks are.
Yeah. So I grew up in Massachusetts watching, I used to pour beer at the stadium when Brady was kind of getting his start. My last game was actually pouring beer was actually the Tuck Rule game. If you all are old enough to remember that,
There you go.
we're against the Raiders in the snow. And then, I've always been a relatively a big sports fan coming from Massachusetts. And then as I started to learn more and more about injuries, about, just medicine and then sports medicine, I realized that a lot of the beat reporters were good, but they just didn't know the questions to ask and they didn't have the insight, medically speaking, rightfully so. So they really didn't have appropriate timelines. That's dramatically changed over the past 6 or 7 years. But back when I started in 2016, a lot of the reporters didn't really know a whole lot. They didn't really give us much information, so we kind of have to dig. And I was, it was difficult for people to understand what this injury means. Why does it this one versus that one? All those types of things that maybe you can get now that you couldn't get back then. So I joined a group of a couple other docs in 2016 called the Fantasy Doctors. And my partner and co-owner is a orthopedic surgeon, foot and ankle specialist up in at the Rotham up in Jersey and Philly. So we've been kind of chipping away for the past 6, 7, 8 years, different injuries, different sports. And then I took my personal practice to Miami, which is where I'm at now. And I specialize in regenerative medicine, which translates to stem cells and PRP and that type of stuff. So, which is what a lot of the players do. Most of them do. And I do have several players that I've treated. And a lot of them, they're really just trying to get on the field as healthy as they can, prevent an injury from worsening, and ideally prevent surgery if possible.
Yeah, I've been following you for quite a few years now, and what I appreciate about the insight too is, I mean, you mentioned it right there, the regenerative um, aspect of this, where you're on the kind of the cutting edge of knowledge in the industry, and that's what a lot of these teams are working with, right? Because they want to get the
Mm-hmm.
best and most relevant information to speed up those timelines and to ensure that they're not going to have re-injuries down the road. So I think that really helps in these cases when we don't have a lot of information. We can kind of get a little bit of peek behind the curtain as to what maybe some of these
Yep.
team doctors are recommending for these athletes. So let's jump into this with Joe Burrow, because obviously he is the big name that everyone's concerned about and has heard about now over the last few days. Him going down with a non-contact injury first week of training camp, obviously a real bummer for him because he has missed quite a few training camps to start his
Yeah.
career with various injuries, and yet another one here. They are calling it a calf strain. Head coach Zach Taylor. Obviously, they don't have to make these injury designations formal, so they can keep things a little bit vague. Calf strain is what they're calling it, and that he'll be out several weeks. So, from the little we do know, and from the video that you've seen, what is your interpretation of this injury, and what is your interpretation of "quote unquote" several weeks?
So this is likely a medial head. I'm going to get medical on you. A medial head.
That's what we got here for.
A distal gastroc strain. And the reason why I say that is because on it was Monday or Tuesday, the day before he injured it, he did not have a sleeve on his leg, which tells me a lot, actually. On Tuesday, or again, whatever day he injured it, he did. So therefore, he actually injured it the day before. Calf injuries are notoriously slow healing. They have an awful blood supply. Their gastroc is responsible for propulsion, so walking, running, anything that pretty much you do, except for standing, is responsible. That's what it does. So you can't not really use it. It's pretty much everything you do in terms of movement. So when he was trying to put a sleeve on it to hopefully not make it worse, it didn't really do anything. And when he tried to scramble to the right, unfortunately, the injury from the day before decided to worsen. So he probably had a mild grade 1, should have sat the rest of the week, but said, you know what, I'm going to push it. It's still early in camp. And unfortunately, it came back to bite him. Now, if this was in week 1, this would probably cost him week 2, week 3, and maybe week 4. Calf strains are a little bit obviously different than Achilles tears, in that when if you look at the video, you can see Burrow actually puts his foot down, almost like you're pressing the gas pedal, and he can do that. So the Achilles is what attaches to the heel and actually allows the foot to recoil. If he had a full thickness Achilles tear, he would have tried to push, but it wouldn't have done anything. He wouldn't have been able to do this over and over again. So that tells me that his Achilles is, I would say, fine, but it's not the main problem. You add in the sleeve, you add in the fact that they said calf, you add in the fact this is a very common injury, at least to this location, and it makes sense. It's the opposite side of his ACL, so that's, I guess, a good thing. And in general, grade 1s are about 10 days to 2 weeks. Grade 2s are a little bit trickier. They're usually 3 to 6 weeks, which is kind of why they said he should be okay for week 1. But if he were to tweak it in week 1, he would probably miss a couple weeks. These are notorious for re-injury. So if he was my patient, I would have injected it today or yesterday with a very potent anti-inflammatory stem cell line, probably 2 or 3 times, to be honest with you, of this caliber, because you do not want to re-injure this. You do not want to cause it further injury, and you need to get blood flow and healing to this area as fast as possible, because this is a non-surgical situation.
It's certainly encouraging when you're talking about him, being able to kind of flex and use his ankle in that way that it doesn't indicate Achilles. At the same time, if he is rushed back, or if he is not 100% in the calf, does that open up a higher risk of injuring the Achilles just by, a factor of putting more emphasis on the Achilles to make up for it? As a layman, I'm not sure how those two maybe interact with each other or relate, but does this kind of open up the door for maybe a weakened Achilles, or just putting more strain on it in general if he's not up to like full health?
Not traditionally, no. You'd think there may be and should be a correlation, but it doesn't seem to be. Um, uh, you really, it ends up leading to more worsening and worsening calf injuries. And you just end up, it ends up gets to the point where you really can't do a whole lot for probably 10 weeks or something like that, which is, a long time. Thankfully, the tendon, that's the distal part of the Achilles tendon, which is pretty much where you tear it almost always, has a very poor blood supply in a very small area, which is why it tears there. The proximal aspect, which is where the gastroc meets and turns into the Achilles, is usually fantastic because it has a great blood supply. This is usually about an inch or two above the start of the tendon. So they're really not, they're along the same tissue lines, but they're usually not directly correlated. He may develop, and this is going to sound funny, but he may have issues with plantar fasciitis after this, which is weird, but for some reason there seems to be a connection there. And he's just going to want to be reluctant. He's not much of a runner, but he can run. He's semi-mobile. that may affect him in a little bit, and he's going to have some issues with stepping into and pushing off. So there's more to it than just walking. He has to be able to be ambulate, and if he's getting pushed out of the pocket, he needs to be able to scramble a little bit.
Speaking more globally to this, obviously with Joe Burrow having missed lots of training camps, he's had various injuries preseason. Obviously, has performed super well in season to date, so that hasn't been too much of an issue. But when it comes to training camps, heat of the summer, we're dead heat of the summer, but these guys got 4 weeks or 6 weeks to prepare for NFL football. Missing that time, how impactful is that to getting your body in a position where it can, be a little bit more flexible and maybe take a little bit more wear and tear than just jumping right into it week one, which is what seemingly now is going to be the case of him really not
Yeah.
having much conditioning until we get to the regular season.
Yeah, and we're starting to see some data that there is a correlation, or at least some causation to say there's issues with spring training camp injuries to translating to summer or early season injuries. The riskiest part of the season is usually the first 6 weeks in the traditional season. That's usually when a lot of the soft tissue injuries. So you can kind of keep an eye on that. Usually hamstrings are pretty classic for that time. Calves can obviously be there. Those are usually the two that you focus on. Quads to a lesser extent, but so there is a little bit of a risk there to say, hey, if we were to translate from this to that, what do we, what do we do? Where are we at with it? Is he super risky? Can this translate to other injuries? And there is some data to support there may be an increased risk of other injuries because of this one.
Switching gears to the AFC East now, we got two prominent players in the AFC East that suffered injuries. Let's start with Garrett Wilson. Obviously, second year wide receiver, made a big splash last year. Latest reports are indicating a low ankle sprain, which, to my understanding, certainly a lot better than a high ankle. What do we know about the Garrett Wilson situation, and what is a potential timeline for that return, especially at his position? Where you plant and got to move quickly. Ankles are a huge part of that.
So I actually watched the play and replay a couple of times. He was on a comeback. He planted, and unfortunately, his ankle gave out, and he was basically like standing on his ankle, kind of type of thing. So if you've ever played basketball or walked in life, you pretty much understand that you've sprained ankle is the most common injury in orthopedics. And traditionally, we injure the lateral aspect, which is pretty much what he did. And as a result, the ankle gave out, went weak laterally, and it kind of rolled. We usually see this in basketball kind of all the time when someone lands on someone else's foot and it causes it to kind of give out. Now, there's 3 grades. Grade 3s are really rare. Grade 1s are the best case scenario, usually a little bit of a mild sprain. Grade 2s are kind of that intermittent where you're expected to miss 3 to 4 weeks or at least a significant chunk of 2 weeks. We don't know the severity here. My suspicion this was closer to a grade 1 than grade 2. There is another injury that I was monitoring for that would have been potentially detrimental, and that's called a Jones fracture. You've probably heard of that, unfortunately, and that's usually the base of the fifth has a very poor blood supply right about here, and as a result, the ankle tucks under, the bone tucks under that, it ends up breaking, and then you end up having to put a screw in that. That would have kept him out for 11 weeks, if not longer, which would have been a big deal. It sounds like he obviously avoided that, but I was a little concerned by how his foot landed. Best case scenario, he's back in about 2 to 3 weeks, which gives him plenty of time to ramp up. He will be at increased risk for re-injury to this. I would personally pepper the heck out of his ankle with whether PRP or some type of product to tighten up those ligaments, to strengthen those ligaments and prevent the laxity, which would allow it to re-injure a lot easier. He's going to need to really be able to move with his feet, not really have to worry about where he's landing, but he may be a little hesitant. So we're hoping that there's no long-term repercussions, but it's not uncommon that these guys continue to re-injure these over and over again. And sometimes it ends up being a little bit worse than a mild injury, whether the fibula is involved, which is what happened to Tony Pollard and eventually Rashad Penny, or if the high ankle is involved, which is another big injury. So I'm hoping that it becomes nothing, but that would be best case scenario. But there's always a little bit of concern until these things kind of calm down and we don't worry about it anymore.
Several years ago, Sean McVay kind of popularized the, ideology of not using any of your starters in the preseason for several reasons, but one being, just trying to avoid any injuries before the regular season. In this case of Garrett Wilson, would you anticipate him not seeing the field until the regular season, or is there almost a benefit to getting him in maybe that final game to see where he's at? What are your thoughts on that?
Yeah, I mean, I see it from both sides. I think the guys weren't going to potentially make the team have a tendency to get injured. I know that sounds funny, but that's what usually ends up happening. Every once in a while, you'll have a big injury that they got injured in the preseason, but they probably would have just injured it in week 1 or 2 anyway. If that ACL is going to tear, it's going to tear, whether it's week 1 or week 3, just whenever the situation happens, because they're usually non-contact regardless. Achilles, pretty much the same difference. The problem is he needs to get on a better rapport with and get into game speed, game shape with Rodgers. So I think that even if they go for a couple plays, and training camp is different than live action. The intensity is a little bit different, and you kind of want to make sure the rust is all gone by week 1. So you want to make sure maybe they play, half a series, or, half a game or a couple series, just to get kind of that comfort underneath their belt. Make sure he's confident in that ankle, so that when week 1 starts, they really don't have to think about it or worry about it.
Yeah, aside from the health, it's almost the chemistry that's the biggest storyline
Mm-hmm.
here between Garrett Wilson and Aaron Rodgers. You want them to have as much time together to be able to develop that. But I imagine with their 2 skill levels, it'll probably be a little less of a learning curve than some other ones. Going a little bit closer to home for you in Miami, Jalen Ramsey carted off with a knee injury, unfortunate, as he's getting ready for his first season with the Miami Dolphins. Had surgery to repair the meniscus, and reports are saying that he may be back in December. Is that too optimistic, or is that a realistic outlook here?
Unfortunately, this was a bad injury. He did get lucky that he didn't tear his ACL, because that would have been, I'd say, the worst case scenario, but one of the worst. Meniscus is very important to the ACL, to the cartilage in the knee, and to the knee in general. And as a result, if you think of it as a piece of paper, he pretty much ripped it in half and kind of flipped it over on itself, if you want to think of it like that. And as a result, this is not something that you just want to trim out a little bit of the meniscus and send them back on the field. You really need to suture this whole meniscus back together and then allow it to heal. Fastest is usually about 3 months. Some guys are usually sometimes closer to 6. So, I think December is possible. I think November is aggressive. It really depends on how he's doing, probably how the team's doing, and to see where he's at. Just an unfortunate injury. I think he was covering Tyreek, for what it's worth. And it was just a fluke injury. It was just something that happened in the way. My suspicion is he probably had a little meniscal tearing in there already, and he just landed and clipped it in the right plane, and that was all she wrote. And after that point, you have to have surgery on it. There's nothing. Even those I'm not confident in getting without surgery. I can inject a lot of stuff that's ugly, but those you really need to tack back down and put back together. If not, you're not going to be confident in that knee again.
Yeah, that kind of leads me into that next question, is especially for a position of cornerback, a lot of backpedaling, a lot of hip turning and things like that. How would he come back from this if it is in December? Would it potentially be a 100% health, or would he likely be at like 90% and kind of have to ease into it? And is just that 10% gap pretty much all mental and confidence in the knee?
I think it's going to be probably closer to 90. The good news is that he won't have the play or the wiggle room that the ACL usually leads to. The ACL is a much more of a mental game than the meniscus. The problem with the ACL is that you don't really trust that knee for the year. That's if you're running, straight and then cutting, the thing that's preventing you from blowing that knee out again is the ACL. So when you put a new one in or rebuild it, it has a little bit more wiggle room than it should or you're used to. So that's why you don't really completely trust it until you do. The meniscus, it's just is it bothering him? And he should be, I would say 90, but him at 90% is probably better than most other similar position players at 100. So I don't know if you're really going to see a whole difference. It'll take a time probably throughout October and early November when he's running routes and he's getting comfortable and he's backpedaling and he's twisting directions and everything. But he can't do that right now. It's too risky. He'll tear that meniscus all over again. The sutures need to heal. That's usually at the 6 to 12 week mark, which is kind of why he needs to do that. Why he needs that extensive time. So we'll see. I think they'll be smart with him early on until he finally gets his full confidence, and then he should be like nothing happened.
That'd be great. A huge boost to that Miami defense for sure. If that return comes in December when they are likely ready to make that playoff push, so that'd be have huge implications obviously for them down the stretch. Let's turn to the AFC South. The Indianapolis Colts. Two Colts, in fact, with some injury news here. More so Michael Pittman, but Jonathan Taylor more so. I wanted to talk about the last year's ankle, and we've had some hold-in deals here. Some saying related to the injury, probably more so related to him wanting to leave Indianapolis. But all of that being said, and I saw you recently tweet this out with Jonathan Taylor. He's got a lot of wear and tear on his body for a 24-year-old running back, more than most 24-year-old running backs.
Yeah.
Is that something where we have concern, even though he's young, that while, yes, he was healthy for the first couple years, to have surgery and the ankle injuries that he had last year, is there potentially some carryover here into training camp? And do you think that may be concern for some teams of a re-injury, and thus maybe his market may not be as lucrative as he thinks?
Yeah, I mean, it's unfortunate. He was up until this past year, he had never missed even a practice. Dating back through high school and college, massive volume, averaging 305 touches per year. Does not catch the ball a whole lot in the NFL. He's averaged about 13% of his overall touches is a reception, so not really much at all. Most of the other guys are running 15 to 20%, depending on who they are. So when you're looking at that much of a volume, you're not really catching a whole lot of passes. So you really are grinding every inch, every yard. That I personally think plays a role in longevity. We've seen some guys that are just freaks that can stay healthy. Your Ezekiel Elliott's just play for many years without really ever missing a game or rarely missing a game. He's kind of that ilk, but Zeke obviously caught a lot more passes than he did. And really, from what we know, has been able to avoid a lot of injuries and a lot of surgeries. As far as we know, Taylor only had a minor scope of his ankle, which is for the most part relatively benign, but may lead to some issues with that ankle in the future. Thankfully, it wasn't his knee. That's a separate discussion. I think the overall state of the running back position is unfortunate in the NFL. They don't really get the respect they deserve and end up getting basically recycled. And if you look at the next year's class, a lot of elite or formerly elite running backs are available. So that kind of hinders him. He's not the only guy. You might have 5 or 6 guys that are very good that are also going to be available. So if he's asking for 10, 15, 16 million dollars a year as a non, PPR, non-receiving guy like a McCaffrey or Eckler, it's different. I mean, Eckler led the running backs in receptions, led running backs in points overall last year, and he made, I think, 6.3 or somewhere around there. And even then, he's fighting tooth and nail. So it's very difficult for running backs to justify their value. And if you look at the overall college and NFL numbers, Jonathan Taylor's already had the 15th or 16th most touches among NFL running backs in 2 less seasons. So, I mean, he's played in 4 less seasons than Zeke, so he's had a lot less time, but a lot more wear and tear.
Yeah, a lot of miles on those tires for sure. Hopefully Taylor either ends up finding himself in a much better situation, or that he's able to just be healthy and turn out a really good year before hitting the free agency market, which we all expect at this point. To his teammate Michael Pittman, similar in that a young guy who has been relatively healthy, apparently dealt with a hip injury all last season, though.
Yeah.
What do we know about the possible limitations of this and how that might have some implications for this upcoming season here?
So hip injuries there's a couple different varieties. If it's relatively benign, that would be your hip pointer, which wouldn't have lasted that long. That's usually when you land on the back of your hip, more of a bruise. Hip flexor, which is in the front, and that's kind of where the quad's attached to the front of the hip. They're more annoying than concerning. And then the lateral hip has where we call the glute med, which is basically the butt muscle, but it's the one underneath it that's responsible for kind of kicking your leg and rotating it out. That loves to throb and ache. That's classic tendinopathy, not concerning, but more frustrating and annoying. The thing that likely is what it was a labral tear in his hip or torn labrum, which are more frustrating. As they start to get worse, they start to bother the player more. Traditionally, they would go in and repair the labrum or trim out some of the bone if there's extra bone that developed, and do both. Doesn't sound like he had surgery. I haven't heard any comments of surgery, and we don't really know what it was. So I have a little bit of reservations. If it is a labral tear, it does not go away. They do not go away ever. They may calm down, but it doesn't take a whole lot to re-aggravate it. So I have a little bit of concerns about that, but not enough to be like, oh no, I don't want to touch them. If this was a knee, that's a little bit of a different story. But for the most part, that's my suspicion. I think he'll be serviceable, very good. Now with a cannon of an arm in Richardson, and just a freak. If he ends up starting, I'm assuming he will. It'll be interesting to see how this team plays out and how the Taylor situation plays out as well.
Absolutely. Yeah, no, Anthony Richardson's best friend is going to be a reliable target, especially a go ball guy like Michael Pittman can be for him. So hopefully, all of that will be ready to go week 1. And, I echo those sentiments. I'm sure he probably will be starting week 1, will Anthony Richardson, most likely. So definitely going to need those security blankets there. And Jonathan Taylor is just as much of a security blanket for a quarterback as one can be, given that running game, taking that pressure off. So really appreciate the insight you provided here. It's great to get a look at actually what we're dealing with and kind of get an in-depth look at some of these injuries because, as we talked about, a lot of these teams, they don't have to report these injuries this early on. And so it's good to get a look at what these videos are telling us and what some of these timelines are. So really appreciate your time. And if you'd like to, absolutely, please do let our listeners, viewers know where they can see some more of your work.
Sure. So thank you for having me. I predominantly spend my time on Twitter. It's the easiest way to access me. It's at Dr. Jesse Morse. The company I write and write for and own is the Fantasy Doctors, DRS. So you can find them there. We're on YouTube or on TikTok. And as the injuries start to accumulate during the season, we do usually individual videos or sometimes break them up into positions. And I might do 20 videos a week during the season, which happens because it gets crazy. And then, if you're in the fantasy or just in the analysis of players, I do a deep dive every year. This year was especially deep into a combination of statistics and injuries. I call it the injury draft guide. You can look at either our website or my Twitter handle and the pinned tweet for further details.
Excellent. Awesome. Great stuff there. And yeah, I can attest it's a big help during the fantasy football season. Someone with like 5+ leagues. I need all the help I can get to know who to put in those lineups. So those insights are a huge help in that. So Dr. Jesse Morse, thank you so much for joining us, and have a great season.
Thank you very much. Take care.